Hi, and welcome to The Wellness of Being. I'm your host, Brad Poirier. Have you ever dealt with chronic pain, a chronic disease, or even with our guest today, only 78 pounds, underweight, and then have a total transformation, which is truly incredible? I want to introduce you to today's guest, John Vella. Welcome, John.
Hi there. Nice to be here.
So I want to talk a little bit about your transformation. So you were only 78 pounds. And what age was this? 16 or 17. And the reason I was 78 pounds was I was suffering from what I found out was Crohn's disease. Mm-hmm. So not only was I 78 pounds, but I was getting extreme cramping. And when I would go to the bathroom, it was diarrhea and it was blood, and I was just getting dizzy. So yeah, 78 pounds and also, incapacitated almost. Mm-hmm. So with Crohn's, is it something that is congenital? Do you have that from birth, or it's something that develops through your life?
Well, the cause, according to Western medicine, is unknown.
Okay. Yes.
However, there are supposed genetic predispositions. I don't know. No one in my family seemed to have anything like that. Mm-hmm. My view is a little different, but on what causes it, yeah.
And the symptoms with everyone, is it different? Or like, what are the main symptoms that most people have normally with Crohn's disease?
The ones I had, big time, like cramping. Mm-hmm. Like cramping as if I hit you with a hammer in the stomach, just like, and then burning, like a flaming hammer. Mm-hmm. How's that?
Yeah, it doesn't sound very.
But like you don't absorb your nutrients, so you, as a result of that, you get dizzy. Mm-hmm. The constant cramping, dizziness, diarrhea.
So with not getting your nutrients, do you think that kind of aided in the weight that you were? Like, so do you think by not getting enough nutrients and constantly having to eliminate and things like that, because your body's not holding anything, that it really affects your weight? So is that your personal story, or is that like a general for most people that have Crohn's?
Typical Crohn's story.
Okay.
Typical, like you just don't absorb nutrients. And you're always going to, you always have diarrhea. And because you're in such pain, you have no appetite anyway.
Yes.
So it's a trifecta of garbage.
Yeah, and I definitely know, John, that Crohn's is part of your life, but it's not definitely your whole life. And one thing which I'm really excited about is that you don't identify yourself with Crohn's, because you've had such an amazing transformation, is really what I want to talk to you about today, because you're quite inspiring with what you've accomplished. So you certainly don't look 78 pounds now.
No.
So what took
I'm 175 pounds right now.
That's awesome.
Sitting right here.
So what took you from being that 78 pound young man to where you are now? What was that transformation process that you underwent? What was your mindset? What was your, how did you change yourself? Or what was your, mainly first we'll talk about with the identifying, okay, yes, I have Crohn's disease, but then you decided, you can tell me what you decided.
Well, I was sitting there in the hospital, and probably, high as a kite on opiates, because that was my life in high school, man. Sitting in the hospital, but I think my brother-in-law dropped me off a copy of some muscle magazine.
Okay, yes.
And one of my, now idols, Dorian Yates was on the cover, who was, Mr. Olympia for 6 years in a row.
Awesome.
Yeah. But anyway, I saw this guy on the cover, I'm like, wow, I didn't even know that was possible. Like, I want to be like that.
Yes.
And I would I would tell my doctors about that, and here I am, this 78-pound kid. I'm like, I want to get big and strong. And then, I started watching UFC in the early days. I'm like, oh yeah, I want to get big and strong and be able to fight. Like, and then all my flashbacks from childhood of watching He-Man cartoons and Conan the Destroyer and Conan the Barbarian, and all that stuff, wrestling. I was like, that's what I want to be. I don't want to be like this. But my doctors were like, yeah, right. Like, you should be happy if you can just live a semi-normal life and walk up a flight of stairs. How about you start there? So they, to them it was like,
Yeah,
no
they
way.
didn't really. They didn't
Impossible.
have the same belief and the same. They didn't think you had the determination. Or sure, you're looking at this magazine. Sure, it's nice. I want to look like this, but they didn't think it would be a reality for you.
Not at all. No.
And I mean, I guess with most, they figure you have a disease. You're always going to have the disease.
Yeah.
We're just going to aid you the best we can, but you're never going to be. Which is, I guess we can let our audience know now. What's your current title now?
Now,
Yes.
well, I'm a nationally ranked bodybuilder.
Mm-hmm.
I won that on May 14th. That was my first show. That was
Certainly amazing, and that's the part of the, why you're here today is that transformation from the person that you were and the person you believed in, the person you knew, and the person you became.
Mm-hmm.
You know what I mean? And yourself now, like holding that gold is no, small feat. I imagine competition can be pretty tough. There's strenuous training.
Mm-hmm.
There's a lot of metamorphoses that your body has to go through to get from this to bulking up. So what would be a normal routine that you would kind of do? So when you first started, you said, yes, I'm looking at these magazines. I want to be a bodybuilder. So what was your next step after that you took as far as achieving that dream?
From when I was like 78 pounds sick?
Correct.
Yeah.
Yes.
Well, here's the thing, right? First, I started with the conventional Crohn's treatments.
Yes.
I was on their heavy course of drugs. I've had 2 surgeries.
Okay,
one, which
yes.
is a major bowel resection. That was, I think, in 2001. Anyhow, so along the way, I was still receiving the treatment just to maybe stabilize me, which was necessary at the time because I would have probably just died.
Yes. Yes.
So at the time, their treatment was all right, just to like for an emergency. But long term, I knew it wasn't going to work. I was just going to keep because I kept getting sicker, and it was just like here comes another surgery, and then. So yeah, as I started. I started with just basic weight training. I started researching nutrition because, I mean, even now, I mean, right now I have a professional bodybuilder, and he's in the NHL of bodybuilding.
Yes.
His name's Stefan. And even with all of his knowledge, he's always learning new stuff. We're always learning. He's even inquiring, asking other pro bodybuilders, "Oh, what can we do now?" So the volume of information is over the top, right? So I was just accumulating whatever basic knowledge I could at a young age, and I slowly started separating myself from the mainstream way of treating people because I knew they had no information for me on nutrition. It was just drugs, and more drugs. And I remember asking, there was this drink they would give you, how there's those calorie drinks like Ensure, Boost.
Yes.
And that's what they would give me to drink. And I started researching. And all the ingredients in those drinks cause inflammation. So I would ask my doctors, why am I drinking this stuff? This causes inflammation.
Yes.
And they looked at me like I had 6 heads and I was from Mars, It's like...
Of course. Yeah, but as you started building your body up, did your body now start to feel a lot stronger, feel healthier? Just more like... totally different than had you been feeling previously, because I imagine with the surgeries and things like that, that's probably pretty painful to go through. Even courses of medication and things like that can probably leave you drained and just tired and things like that. And that's probably part of the natural thing with Crohn's, that you're really not, you don't have all kinds of vitality and things like that, where you are left. Like, so with Crohn's, are you mostly just tired all the time?
Tired,
you have a lot of body pain,
cramps, diarrhea, or constipation, depending on what the bowel wants to do that day.
So I think now with the change, so now, yes, you're experiencing pain, but now in a whole new way. Because now with lifting weights and doing all that kind of stuff, this pain that you're experiencing is a totally different pain, because this is more pain of success, pain of joy, pain of now seeing the transformation, as opposed to what the past was. So now we're going to leave the past part of your life now in the past, and we're going to concentrate on where you are now. And where you are now is the 2016 champion. You're getting ready for your next levels and the training. What's a course of training like? So if you see your mentor or your coach, now what kind of routine would you normally do? Do you work the whole body in the same day? Do you break it up? Or what would be a typical week of working out sort of thing?
We break it up into individual isolated body parts.
Okay.
So one day, like yesterday, we did quads, thighs,
Yeah. So what would be a typical exercise, like say for quads or thighs or something like that, that you would do?
Leg extensions, leg presses, squats, whatever Stefan and Andrew want to do that day, that's what I'm doing. I'm listening to them.
So do they generally just assess where your body is and where it needs to be? So if they're helping you with competition and they say, okay, you need this more defined, or you need this, or you need more work here, they gear your workouts more towards that, or is it more like a general?
Depends on the bodybuilder.
Okay.
I have pretty decent symmetry, which means everything, one part doesn't kind of just stand out from the other. My next goal is to put on size symmetrically, but pretty much everywhere.
Yes.
So we're just trying to make everything grow. Maybe someone else would have that issue if they didn't train legs ever in their life and had a good upper body. Like they'd have to put more emphasis on legs and let them catch up. But for us, we're just, I just do what they do. Yeah.
So when you're competing, does it really matter about height or body shape or things like that? Does that determine, do you have more an advantage being a certain body type or a certain height?
Yeah, I mean there are genetic advantages that I think I do have, and that's like a small frame. Like I have a smaller structure. So, let's say you took someone with a bigger structure, like a bigger frame, bigger joints, and sat him next to me, and we both weighed 190, and we were both, let's say, 3% body fat. I'm going to look bigger than him because more of his weight is skeletal mass.
That's right.
You know what I mean?
Yes.
And more amount will be muscle, so I'll look more, I'll pop like a cartoon,
Of course, yeah. So just let us know, our audience, so where is your body fat now? Like your percentage-wise?
Right now.
So when you're in peak competition mode.
At contest shape. Well, that was one of the reasons I won, actually. Because when I won my first show, it was against a bunch of competitors who were way bigger than me. Like the guy who finished second, he was a super heavyweight.
Okay,
so
yes.
he was over 100 pounds heavier than me. But the reason I won was my conditioning. So my body fat was so low, my coach said, like, the calipers won't even read you. So he estimates it was under 2%, maybe between 1 and 2%.
Okay.
I don't know, because the calipers, it was so low it couldn't be right, as you could probably see by those pictures.
Yeah. So would the average competitor be within that range normally for body fat?
Typically
usually?
3%, 2%, 4% and under.
Oh, okay.
But 4% you may look a little soft, which sounds ridiculous to the general population, but
no. But I guess if you want to be more defined, the less fat you have on your body, and the more muscle you have to show, the much better it is.
Yeah, you want to peel off every bit of fat possible.
So when you're competing, basically, I mean, you're just, I think, newer in this arena and there was a turning point for you when you said, okay, I'm bodybuilding, I'm working out and things like that. There must have been a light bulb that went off in your head that said, hey, I think it's now time to move a little bit more pro or become a more of a professional, things like that.
You mean specialize in bodybuilding?
Yeah, instead of just working out. So now my body's feeling better, my body's feeling stronger. Now where do I want to take this? Sure, it's nice, I look good and things like that, but now do I want to go more hardcore and let's do some more things? And I imagine getting into more competition, you're up against some guys who are like seasoned pros that have been competing over and over and over. How many people would normally be in a competition usually?
It varies. It totally varies.
Okay.
On the size, I mean, let's say it was some local show in Sudbury. That may only have a handful of people, but a Toronto-based show may have hundreds of competitors.
Oh, wow.
And then as you go to the provincial level, there's more competitors, and the competition keeps getting higher and higher. So.
But do they break you down into different categories? So say if you have 100 people or 50 people or 10 people, do they break that category down? Because you can't be all, I don't imagine you could be all posing, all at the same time, 100 people. It's very difficult for the judges to, or do you go on
on a stage,
segments?
they only allow 7, I think it's 7 people.
Okay,
at
that
once,
they can look at the same time?
Something like that. Between 7 and 10 people, I think maybe 7. But then, so if let's say there was a group of 20, 7 would go up, and then the next 7, or I think it's 7. I could be wrong.
When they're judging, what are the main things really that they're looking for to make it, for you to be, a winner in a competition?
They look for size of the muscle. They look for the shape of the overall frame, symmetry, you know, how everything fits together, conditioning, which is how low your body fat is, how dry are you, separation of each muscle group, and just the overall package, you know, like is it aesthetically pleasing?
Yes. And I mean, I imagine that nutrition is fairly important in what you do, because obviously eating Haagen-Dazs every day and a couple of 2 liters of soda or pop, you know, I mean, it probably doesn't really do much for putting you into the, you know, first or second place.
Maybe if you're doing sumo.
Yeah, of course. So what would be a normal, so what would your intake be of normal, like proteins and carbs and like your veg and stuff like that in a day? So what would your typical meals be in a day when you're competing?
Yeah, it's hard to answer with one direct answer because it was always changing.
Okay, yes.
My coach would always take a look at me, like, you know, every day he was literally looking at my body and I would be sending him pictures. I mean, luckily we train at the same gym, so he would take a look at me all the time and assess what I need to do for that week. But protein was always kept high, well over 300 grams. There were always high contents of green vegetables pretty much the whole way. A lot of green beans, asparagus, spinach. And as far as the fats and carbohydrates, those would be modified depending on my level of conditioning.
Oh, that'd be awesome.
So now I'm gaining mass. Now we're off season. Like I'm gaining size. Yeah. So I've increased my fats. I've increased my carbohydrates. Come as you're getting in condition for a show, you decrease your carbohydrates and fats as required.
Oh, okay. So then basically when you're not competing, then you you don't train as hard in those times?
No, you train just as we train hard all the time. We always train intense, always. Yeah. And the protein is the one thing that's always kept high. It's just your source of energies, like, you know, your fats and carbohydrates. Those are pretty much the only variable, like, because we train hard all the time. It's just when you get closer to competition, you may be a little more careful and not maybe use as much weight, because you're depleting, you're more tired, your joints are drier, you're shedding water, so you may be a little more careful. But you're training in terms of intensity and how hard you're always training hard.
I know your transformation is truly incredible. From 78 pounds to saying, I'm not going to identify as a patient of Crohn's. I'm going to change my life, change my body. You know, that's certainly incredible. We're going to have, if our viewers want to follow you, they can follow you on Instagram, listed at the end of the show here. And I want to say thank you, and we'll be right back after the break. Welcome back to the Wellness of Being with your host, Brad Poirier. Losing a loved one is never easy, especially when you have a young family. My guest today, Christine Peacock, shows how she turned her tragedy into a triumph. Welcome, Christine.
Thanks, Brad.
So I'd like to dive right into it, and having a loss is never easy, and I really want to hear your heartfelt story, you know, leave every detail in, because I think our viewers really want to know what it's like, and they may find it difficult and they don't know how to go through the process. So if you'd like to start there, just give us a little bit about the background, maybe even maybe a little bit of history, or even how you met.
Absolutely. Well, Brad, when I was 17, I met my then first boyfriend, who became my husband when I was 21 years old. Oh. And, you know, we did all the regular things. We got married. I went to school. By profession, I'm a teacher. And we had our children. And when I had my third baby, our third daughter, in 2012, I was on my maternity leave with her, of course, and she was about a week old, and it was on that day, she was 7 days old, we knew there was something wrong. Now, the irony is that I had my daughter at home, and so I didn't have to go to a hospital to have my baby. But she was 7 days old, and we rushed to emergency. We knew there was something wrong with my husband. By the time she was 8 weeks old, he had a cancer diagnosis.
Oh.
So we had a newborn, we had a 4-year-old and 6-year-old at the time, and we had also adopted my husband's younger brother, who was about 16 at the time.
Okay.
So we were a busy family.
Yes, yes.
4 kids and the 2 of us. And I remember getting the cancer news, and we were sitting at the office. He had just had, it was colon cancer, and he'd had a procedure done, and we were sitting there, and I didn't realize it at the time, but my husband's face was just white. And of course my newborn, she was in that little bucket carrier, and I was just chatting with the receptionist, not even thinking there was an issue. And we sat down, and the doctor said, it's likely a colon cancer tumor. And I just remember the 2 of us just crying and shaking. And it was in that moment, you know, I had to ask the receptionist to hold and carry the baby back to the car, because in 5 minutes, we had to pick up our other 2 kids from school. And the reason I'm sharing that story with you is because that was really the moment when we had to, and it was a defining moment, because it was the moment where we had to say, we've been dealt some bad news, some harsh reality, but our circumstances are that we've got 3 little kids who depend on us and who will be scared, and we're scared. And we don't have a choice to have that fear in front of them. And so we had 5 minutes to get ourselves together with this terrible news and wipe our tears and pick up our daughters from school.
So with the cancer itself, before you go any further, were there any signs? Did he feel any different? Did he notice anything, especially if it's colon cancer? Because I do have friends that have passed on from colon cancer at a very young age. Like I had one friend, you know, she just turned 40. You know what I mean? Found that she had colon cancer and shortly after then passed on. But with your husband, was there any signs there? Was there any, like he was just feeling weaker, or was there anything like when you have bowel movements or anything like that? Because assuming with the colon, that's where you would kind of notice first, or was there just no signs at all?
He had digestive discomfort, and so when we went to the doctor, they were actually expecting it to be Crohn's or colitis.
Okay.
They weren't expecting a cancer tumor there at all. He didn't have the typical blood or, you know, he had pain, but it wasn't the typical things that, you know, somebody normally gets. And again, like you had said, a lot of times those colon cancer diagnoses are somebody in their 60s, 50s or 60s,
Yes.
even when people start getting colonoscopies. So he had pain, and it was just persistent pain that just had been there for years, and he'd had other procedures, and we never figured out what it was. And then he got the colonoscopy, and that's what revealed that there was a blockage in there.
Okay, yes.
And so what we had to do following the confirmation of that biopsy that it was colon cancer was surgery. And so he had the surgery, and again, the irony is we go in there into the pre-op, and I've got a newborn, and the nurses are looking at me saying, you know, of course you know what it's like to have an epidural, because this is what your husband's going to have. And I didn't know what an epidural was like, because I've always kind of gone on the path of being a more natural person.
Naturally, yes.
And so with his surgery, he needed the epidural. And so he had the surgery, and they told us that the chances of recovery were very good.
Oh,
they got the whole tumor. They had noticed that it was in some of the lymph nodes and on the aorta, but they felt like they'd gotten everything. And the way my husband described it was the chemotherapy was just it was just there as a precaution. Because he was so young, get the chemotherapy, get the drugs, get the treatment, just to make sure that everything was blasted. So the colon cancer chemotherapy was really tough. It was not pretty. It was the cycle of chemotherapy was every 2 weeks. So he had chemotherapy twice a month
Okay.
for 6 months. So it was 12 rounds of chemotherapy.
Well, that must
And-
be a lot on the family too, because having to go twice a week, plus having 3 small children, it's not like get up and go, because I don't imagine he would have enough strength to kind of drive himself there, get the treatment, and then return and say, "Hi, honey, I'm home."
Exactly.
You know, I think you'd probably have to get together and either you drive or get all the family together or find some kind of alternative, so that for the kids and themselves, being young, getting everybody together, going off, doing the treatments. And then how long would you be there when he was having his treatments done?
Yeah, so the chemo treatment in the chair was probably about 6 hours.
Oh, wow.
It was a long treatment.
Okay.
And they would, he had a portacath, and
Okay.
he would sit in the chair, receive the chemo treatment in the chair, and I went with him for every single
Yes.
chemo treatment. I drove him. And of course, you know, having family support
Yes.
and support from friends is super important. So we had people taking care of the children so that I could be there
Okay.
for him.
Yeah, especially a 6-hour span. It's a lot with 3 young ones to try to get them. They
Exactly.
get bored, they get tired, they get, you know, nervous, scared, whatever. They see
Exactly.
that environment and
Right.
they know something's going on. obviously.
Exactly. And so, and then after the treatment, my husband had to wear his chemotherapy home for 2 days. So it wasn't just chemotherapy in the chair.
Okay.
He was then, he would take another chemotherapy home, and he, just like the pocket that you have there,
Yeah.
he'd put the bag of drugs
Okay.
in his pocket, and he would wear the chemotherapy for another 2 days.
Okay, and it would automatically
It would
inject
automatically inject
Okay.
the drug, and then 2 days later, a nurse would come and take off the
Okay.
disconnect.
and redress. Yeah.
And the hard part with the chemotherapy and having the young children was he couldn't hold the kids. So during that time we had, you know, a baby who was between, you know, she was probably between 5 months and a year
Okay.
old when
Yes.
he was going through treatment. He couldn't hold her because, of course, little babies at
And
that
that's
age, they just
tough.
want to pull
Well,
things.
and they need, you know what I mean? And yeah, they long for touch, they long for bonding, they long for, and especially if you don't have, you know, a parental kind of figure there, and when you're crying out, and if you're the main figure that they have to go to because he can't do it. And that must have been obviously frustrating, I imagine, for him.
Absolutely.
Here you have your own kids, your pride and joy, but yet you can't even touch them, you can't hold them.
Yeah.
You know?
And that was tough for him because he couldn't hold our baby, especially the youngest one. And I remember him telling me when his cancer turned terminal, I remember him telling me that he didn't want to get to know her.
Oh, okay.
And he said, I don't think it would be fair for me to get to know her because she won't have a lot of time with me.
No, and it's much harder to leave, I think, for
That's
both
what
of them.
he felt.
You start to bond, and now they're gone, especially when you be young. Same for him. The more he gets to know her, the more he's going to love her, that he already does anyway. But now it's like, when I'm not going to potentially be here.
Yeah.
Because you don't really know. I mean, it can go either way. You can go into remission,
Exactly.
you know, things like that.
But I had told him at that time, I said to him, you know, I said, whatever time you have with her is precious.
Yes.
And she may not remember those moments, but you are her father, and whatever you can give her will help her become a better person.
Yes.
So I said to him, I said, don't feel guilty. Don't push her away.
No.
As hard as it is, I said, don't push her away. You've got to love her. You've got to let her get to know you, because even though she may not remember, you know, moments and experiences, you will give her things that
Yes.
will just be part of who she becomes. And that was a difficult conversation we had to have with our children, because after his 6 months of chemo, we thought everything was back to
Yeah, of
normal,
course.
right?
Yeah, because they said we got it all.
They said
you know?
we
Yeah.
got everything.
You think free
Yeah,
and clear. No more
it's-
2 times to the, you know,
Yeah.
treatments, all that kind of stuff.
Exactly, but then about 4 months later, he was in a lot of pain again. And we went back and found out the cancer had spread.
Okay.
So it had spread, you know, I guess through the blood or the lymph nodes, and
Yes.
it was everywhere. It was in his
Okay.
lungs, it was in his back, and his abdomen.
So even too much, even to have surgery, or even
yes.
chemo wouldn't kind of take care of you know, what he had.
What he had, and so we did do some more chemo. It was different chemotherapy by that point.
Yes.
Because they were researching new drugs, so he tried the new drugs.
Yeah.
And he tried some oral chemotherapies as well. And we just kind of resigned ourselves to the fact that he's going to live with cancer. That it was a stage 4 cancer. He wasn't going to be cured from it.
No, but it's a part of your life.
It was
that
part
you
of our
have
life
to adapt to and stuff like that.
Exactly.
So with him, was there hair loss with that as well?
No, he didn't have hair loss.
Okay.
So I guess it depends on the type of chemotherapy.
Yes.
And so he didn't have to deal with that. He had other side effects to deal with, things like anything that was too cold or too hot in his mouth, or just even a breeze. He could feel it in his fingertips.
Yes.
And the hardest part of chemotherapy, kind of one of the things that people don't tell you about is, you know, how it affects a person, you know, their personalities, how it affects their feelings. You know, there's so much going on when people have a cancer diagnosis.
Yes.
It's not just the disease, it's not just the cells in your body, but it has to do, you know, there's so much in terms of, you know, psychologically what people are dealing with, and as well as their families. You know, it was tough on our, I won't sugarcoat it, it was tough on our marriage. You know, at the one time, I want to be supportive of him, but sometimes, you know, it's tough being a caregiver.
Well, and very draining emotionally and things like that. Plus, you have the 3 small children as well, plus your own self. And you have nowhere to run, nowhere to hide. You can't lock yourself in the bathroom and take a bath for 2 hours because he's unable to take care of them.
Exactly.
It's mainly you're the one. It's the same, I think, as having an elderly parent or a sibling that has some kind of, you know, debilitating circumstance where you have to always be there and stuff like that. And it really, I think, kind of tests you for who you are as a person and who you are. I mean, just going back to what you said earlier, but just having that talk, even though difficult, but was really great wisdom, I think, from what I'm hearing. It's important to make time for those people because you never know. And even if it's that 30 seconds or even a smile at someone, you never know the change that you're going to make in their lives, rather than saying, well, I've just resided to, you know, and I'm kind of done and I'm going to disconnect. Where I think even that little bit of giving and a little bit of sharing and even what you're doing today with our guests, you're also sharing your story, which is very real, very raw, and to relive it, I know is not always pleasant, but I know it because there's stuff in there that people could help, because either somebody is going through it or somebody knows who's going through it, to say, it's okay, I can be frustrated, it's okay, I don't have to be happy all the time, I don't have to be say, hey, cheer up, it's gonna be fine.
Yeah.
You know what I mean? Like things like that. So getting back to your story now, so I mean, being frustrated or trying to carry on, you've got to take care of him, and now you have to take care of the kids.
Exactly. And then when the cancer turned to be more terminal, where there was a point where he was declining, and he wasn't able to sleep in our own bed anymore. Just even physically lying down was uncomfortable. He was in so much pain. And I remember saying to the doctor, I said, it feels like something has changed. It feels like something is different. And although on scans and blood work and paperwork, she said things haven't changed on paper. I said to her, it just feels like something has changed.
Yes.
And then of course they did some further probing and further analysis, and it had revealed the cancer had spread again, and there were blockages, so he's no longer able to eat. And that's when we got the news that they called the cancer terminal.
Oh, okay.
And they said, that was in January 2014, they said it would be about 6 to 12 months. So we had this news that we had to digest, and we had to come to terms with, and we had to absorb. But all the while we had to protect our kids.
Yes.
And I was always, and being an educator by profession, I'm always very conscious of what you share with children is important. We don't want to lie to our children, but we also had to be patient with ourselves to be in the right frame of mind to
Yes.
share the news with them. And I remember I did a lot of reading and a lot of research on how do you tell kids the worst news in the world.
Of course.
And
yes.
of course we weren't able to tell them right away because we had to absorb it ourselves. And at that time our children would have been not even 2,
Okay. Yes.
6 and about 8. And in one of the books I read, they said no matter what ages your children are, you need to tell all of them all at the same time. And I remember thinking, that's really weird because my youngest can barely talk. How would I be able to tell her at
Yes.
the same time as my other ones? But it's funny how children react to
Of
different
course.
things.
Yes.
And so we told them all at the same time, and of course we're all crying.
Yes.
It had to be a composed cry, not composed cry. I was real and
No,
raw
but you
with
don't
my
want to.
children.
Yeah, you don't want to lose it.
You don't
want to
have an
kids are
ugly,
there
you don't want to
and
have an
stuff
ugly
like that.
cry and scare
No.
your children.
Yes.
So we were composed, but of course there were tears, and my 2 oldest had trouble, and my youngest one, not even 2 years old, I remember her grabbing tissue and just handing out tissue to everybody. And so she knew something was wrong, and she
Yes.
tried to do what she could. And that was always my conviction with going through it was, however scared I was, I didn't
Yes.
want my children to be scared.
Well, I want to thank you, Christine, for sharing your truly inspiring story. I know we have more to come because I said, going from tragedy to triumph. So if you stay tuned, viewers, on another episode of our program, we're going to show Christine now to show what she did with going from that tragedy and making it a triumph. So I thank you for viewing today, and we'll be back soon. Hi, and welcome to The Wellness of Being with your host, Brad Poirier. Have you ever suffered from headache pain, back pain, just chronic pain in general? It's really a drag. And why do you have to suffer when you don't really need to? My guest today can help you alleviate some of that pain. Dr. Kent Newton is here from Alliston. He's going to talk a little bit about what he can do to help you with your body pain and things like that. So welcome, doctor.
Thanks for having me on the show.
Yes, so tell us a little bit about your background and what exactly that you do.
So I am a chiropractor, so one of our main purposes is to take a look at the spine to see how the spine functions. And so we take a look at how the muscles are working, how the ligaments are working, and the overall health of the spine. And as you asked me before, is that when we go to school, I've been to school for about 4.5 years to become a doctor, and that was after university. So there's quite a lot of training that we have to get to this point.
So when you were taking school, what was that turning point in your life when you found this is going to be my passion? I really want to alleviate people's pain, or what is really the turning point, or what was the defining moment in your life that said, yes, this is what I want to do. This is going to be my career, my life, my joy, my passion.
Yeah, so what happened in my family, my mom was a public nurse, and we always were talking about health conditions and how to get healthy and things like that. And I've been under chiropractic care since the age of about 10 years old for regular maintenance and wellness care. And it was that point that my chiropractor reached out to me and said, why don't you follow me in my office and see what I do as a chiropractor? So I would help him at his office, doing different things at his office, learning about what a chiropractor does. And that's when I fell in with my true passion. I love what I do. It's the best job going on. I absolutely love what I do. So he was the one that got me into chiropractic, got me taking the right courses in university, then helped me apply to CMCC, which is our college that we go to in Toronto here, and that's how I became a chiropractor.
Wow, that's very interesting. I know a lot of viewers would like to know, I've never been to a chiropractor before, what's really involved? So when I make my appointment and they come and see you here in Alliston, what kind of process do you take the patient through before you actually do an adjustment or a treatment?
Yeah, so when a person comes in, we're not even actually sure whether they can actually be a candidate for chiropractic. So we do start with a thorough history taking. From that, the history allows us to design the examination that we need. And then if we feel this necessary, we might even do x-rays. And that just to show us, any sort of things we have to watch out for in the spine potentially. And then from that, then I'll sit down with the patient, explain to them what we're doing, how we're doing it, and what their role in the whole process is. Because it's a teamwork approach that we like to use at the office.
That's amazing. Now I see that you brought a lovely model here. You're going to do some
Yes.
demonstration for us so our viewers can actually see what a treatment would be like. So with this model here, what condition is she potentially suffering from right now that you're going to show us?
For sure. So this is Martha. She's helping us today here. And so basically, when we look at, particularly with the neck area here, the nerves in the back of the neck here typically wrap around the back of the skull, go behind the eyes and to the muscles of the face. So when we get pressure on those nerves, it could be typically things like headaches or neck pain. And so basically, as a chiropractor, we've already pre-assessed her, and we know that she does have an area of her spine that shifts it off to the side. That can put pressure on those nerves, and that's what's going to be causing her symptoms. So in that situation, we're going to be doing more of the upper neck adjustments. And then if someone had more stuff in this area here, well, who's heard of texting neck, right? I see a lot of that in the office now with the kids texting on their iPhones and iPods. They're getting that band-like pressure across here. If we get enough pressure on those nerves, we can actually get stuff coming down the arms. You have that zinging arm pain that comes down.
Yes.
So, I mean, neck adjustments, are very, very gentle. There's different ways that we can do it. So we're going to demonstrate a very, very easy neck adjustment. We're going to work on this area right here, which is where the problem is with her. So it's just very gentle. We just take to the head of the side and we just apply a little bit of force, just like that and that. And there we go. Perfect.
And do you find most people tend to suffer with a lot of pain, especially in their neck or in their trapezius, which is just connected to the neck and stuff like that? I think a lot of women can get it just from even just carrying their purse or just body shape and things like that. That you have all that extra stress that people hold.
Yep.
And is it the pain that's in the neck? Can that be caused from stress, or is it just mainly something within the body, or is it all kind of related together?
Well, you've got some great questions. So I guess the first part is that most of us have some sort of level of sitting job. So we know that most people sit for almost 8 hours a day is what the average is right now. And most of us are sitting at a job doing a desk. So that means you're doing things like this. Well, look at my posture. That is definitely not good. That's going to put stress up in here and all through here, right? So we have three main causes that can cause shifts in the spine. We have things we call traumas, which are falls, bumps, spills, car accidents, old injuries that have healed wrong, very, very common. We had a patient last week that has suffered from a motor vehicle accident 12 years ago, and now we see the damage that's happening in spine from that. And then also in that category, we're going to have things like the A word, which is the arthritis. The second category would be things like thoughts. When you get stress or you get anger, things like that can definitely affect your spine. And the last one we call toxins. Right?
Okay, yes.
So making sure the body's well hydrated will definitely help the health of the spine. Making sure that we eat healthy foods, we take our supplements. We want to try to avoid things like the pesticides and the preservatives and bad fats, basically. So all those three categories will ultimately affect the health of you and the health of your spine. So that's part of the teamwork approach that we're going to use in the office.
So if a client comes in or a patient comes in, so typically how long would a session take for you to do an adjustment?
Right.
Like your average times, shortest to maybe longest time?
So it all depends what we're doing on that session. Sometimes we might be working on giving someone exercises to work on to help to strengthen their spine. We might do some basic nutritional discussion, or we might do some muscle work too. So again, on average, you're probably going to be in the office maybe about 15 minutes, 20 minutes.
Yeah, and I think what people want to know too, like I saw you just do the adjustment now, and it didn't look like there was very much pain or any pain at all. Does the patient feel any pain when you're doing any of the adjustments, or could it be related to what maybe the injury is or that sort of thing? Because I know you'll be demoing today a couple of different things. So right now we're looking at head, neck, shoulders, and they're going to show us some lower parts later on. But for right now, just with her sitting there, if she comes in just for the quick adjustment, that takes under 5 minutes, does she feel any pain? Or after she has the adjustment, will she immediately find relief, or does it usually take a couple of days after the adjustment?
For sure. So when people first come in, generally what happens is the joint's irritated, it's angry, it's inflamed. So when we work on those joints, there can be some mild discomfort, and it's just temporary basically at that point. Our main goal in the beginning is to get the area to move, that's it. So most patients do find the adjustments very, very comfortable, but then we also work the patient through that process. So the adjustment you saw me do with Martha, that's to get to that point has taken a lot of extra examination and time in the office. So we've sort of shortcut a few of those steps steps there.
Yes.
And then once we get, like Martha's been with Under Care now for a number of years, so her adjustments, now that her spine is moving properly, it moves very easily, so it's much easier for me to do the adjustments. So they're much, much more comfortable at this sort of stage.
Yeah, so people know when they come in, it's not, it's my first time visit, I'm going to be in and out in 5 minutes, so I can't book, a back-to-back appointment with someone else right away. It's good to come in, do the time, come in to your first time visit, do the history.
That's right.
If an x-ray is needed, because I imagine with an x-ray, it shows you much better actually the physiology of the body, if the spine is in alignment, what you kind of have to look at, if the hips are balanced, things like that. I guess a lot of that can also tilt the body and also kind of put it out of balance as well.
Absolutely. So that's where we get to that point, is that we find out what the patient wants. There's different types of care we do in the office. There's relief care, which is for people that are in pain. We have corrective care, which we can actually work on improving someone's overall spinal posture, and in some cases help to slow down the progression of arthritis, so that's exciting to work on. And the last one is like a wellness program, where we're just, the idea is to maintain the person. That's where Martha is at this point, and in a few moments you're going to see her son Jacob, and they're in for what we call would be the wellness part of it that we work on in the office.
Oh, that'd be awesome. So yeah, if we can switch you guys out, we'll get Jacob here, and then we're going to show you something a little bit different. So I think now you're going to work on the back with Jacob?
Yes, so in chiropractic we have three main categories of adjustments we can do. We can do adjustments with our hands that you just saw with Martha.
Yes.
We also, in our office, we have special drop tables, so we can use gravity to help us with the adjustments. And then with some of the patients, we'll use something called an activator.
Oh, wow.
So it's a handheld adjusting instrument. So having these different options allow me to see, well, the infants. I mean, the youngest infant I've seen, actually, we had a patient come right from the hospital with their baby. It was a bit of a difficult delivery, so they wanted to come to the office right after, so it was probably with less than a couple days old, doing the first adjustment on that baby. So we can work on the infants all the way up to the grandparents and everyone kind of in between. So this is Jacob. He's been with us for a while at the office too, doing what we call the wellness type of care. So,
Yes.
so with him, we do two styles of adjustments. We're going to use our hands through this area here, and then we're going to use the activator part for his lower back.
Okay, awesome.
So this is a really common area for people to have problems in here. It's right below the rib cage. It's almost like a slouch point. So people get in that chair and think, oh, I want to slouch down. So it's common to have issues in this area here. We would definitely want to work on that area. So in that area here, what we're going to use, I'm going to use my hands. He's going to feel a bit of a squish. We kind of call it the big bear hug sometimes. And we're just going to be doing some gentle work right in this area here, nice and gentle. And you can see that he's nice and relaxed. He's not flinching. And then we're going to also get down to the pelvis. And with the pelvis, we want to also look at the hips. So we know that a lot of low back injuries come from malfunctions of the hips. So we can easily check his range of motion of his hips by rolling the leg out and back. And we want to see a nice floppy leg back and forth. And we want to make sure both sides are even, because that is the key. Your spine's supposed to be a mirror image, and you want it to be equal on both sides. So we're going to work on this side over here with him. And so this one we're going to use, we call the activator here. We're going to come right onto his sacroiliac joint here, and we're going to apply the force like this. Sometimes we call this the woodpecker. The kids get a kick out of that. And we're going to come into here and do this little area right here. And then what we generally do, we're going to reassess afterwards to make sure that we're getting the motion we want to see. And so that's it. We're all done at that part.
So would you say that the main cause of back pain is just due to poor posture, or are there other causes that a lot of people experience, lower back pain or mid back pain or things like that? What can be some of the other causes of having back pain?
Well, I think one of the biggest ones is using your back the wrong way. I mean, we've all been taught about proper lifting techniques, but how often do you have a pencil on the ground and you just bend at your waist instead of bending at your knees? So the key is to protect your back. You're supposed to have it for your whole life. And again, when you see people in back pain, like last week, I mean, I had a patient that was concerned they're going to lose their job because their back was so painful and they couldn't work. So the biggest take-home point we have for people is take care of your back early, take care of it for your whole life, and it's going to last your whole lifetime.
Yeah, that's great to know that you can do a wide range, right from an infant right up to a senior citizen. I guess everybody needs, an adjustment of somewhat. Is there a certain patient who you're unable to treat?
Well, typically, The examination will tell us that.
Okay.
But if we get someone that has, a very, very fragile spine, or they have mobility issues, I mean, in our office, you have to get into the office. So if you can't physically get to the office, that's probably a good indication that maybe it's not the best.
Oh, okay.
But I have on certain occasions done house calls. Last year, we had a person who was actually house ridden, so I would go to her house, do her treatments in her house.
Yes.
And finally, we got her mobile enough, she could get back into town, and then now she's in the office now. So, it all kind of depends. So each case is dependent upon what the person presents with, for sure.
Yes. So with your office, is there just yourself at your office, or do you have other practitioners, or who else works at your office just here in Alliston?
Yeah, so in the office we're lucky because I'm also an acupuncturist, so if we need to, we can do acupuncture, but also in the office we have a massage therapist that can give us a hand too when we need some more of the massage work taken care of. So we kind of have it all there. So it's nice to have all the tools there, for sure.
Perfect. So we're going to go to your last demo. So we're going to switch these guys out, and then you're going to do one last.
We'll get you on your back here for me. You roll on your back. Perfect. And so this one here, we're going to do some muscle work, basically. As we mentioned, the hips are a key thing. We see a lot of people coming in with injuries for soccer. So one of the big issues that we see the psoas muscle.
Okay.
I'm going to bend your knee up here for me. And so basically with the psoas muscle, this actually attaches to the lower back, and when this muscle gets tight, it can actually pull the lower back out of position, causing them problems and affecting how they strike the ball.
Yes.
So what we do, we find this area here, it's a little ticklish, isn't it? Yeah. So we work on this point here, we release that muscle, and then we'll go and assess the hips and do an adjustment again. So we get in the muscle, we just hold it for a little bit, the muscle starts to release, and then we can work on those trigger points.
Oh, perfect. Yeah, so it's nice to know that people can come in, they don't have to suffer with headaches. With going back to our first model, with headaches, because so a lot of people, if they suffer from migraines or stress or just regular headaches, so do you combine your treatments, so chiropractic with maybe perhaps acupuncture and things like that as well, or do you find and determine which would be the best treatment for them, or do you just use them cohesively together?
So it all depends what the person presents with. Sometimes we will strictly use chiropractic if it's a spine-related issue. Sometimes if the muscles are causing a problem, we're actually going to use the acupuncture to help us get into the chiropractic part, or we're going to use it all together. So we have all those different options, and then if we need to, we can refer them out to the massage therapist that we have also on staff there. So again, we have all these amazing options to help get people the health goals that they want.
So perfect. So I just want to go over again. So if somebody were to come to you the first time, what's the best way to contact you, number one?
Yeah, so absolutely. The best thing to do is call the office. You'll meet either Joe or Melissa. They're fantastic. They'll take care of you. They'll answer all your questions. And if you want to make an appointment, they'll probably direct you to the website. We have what we call a health pass on there, which allows someone to come to the office. We do the complete examination and the x-rays. There's no cost to the person. I actually pay for the x-rays. So I want to have the information. And then we sit down. We're going to give you all the results before you make any decision.
Oh, that's wonderful. So it's nice that people know they can come in. You've certainly shown us a lot today that, how quick and easy the adjustments are. So when they come in, it'll be easy and effortless, that you really take the time to go down and really look at the x-rays, look at their body, really get the full perspective on what that client needs, or what that customer needs, or what that patient needs. So when they come in, so if you guys switch, we'll do your last quick adjustment. Do you have one more coming?
No,
or we just that's it. Okay.
That's it at this stage.
So awesome. So with doing the one with the neck and shoulders and things like that, I find that probably people coming over and over and over will find that they're getting relief continually, as opposed to a lot of people think I can come once and then all my pain is gone.
That's
and
right.
Obviously I think you understand that's probably not true. Some people may need a series of treatments. Some people may find that maybe, do you find that people just one would be enough for them, or there's always, depending on what it is and the ailment and that sort of thing?
So we always hope that we have the adjustment, get the pressure off the nerve, the person jumps off the table and they feel awesome. That's what we go for all the time, of course. But then some cases are more like a dimmer switch, so in the beginning they might need a series of adjustments to get the process started. And sometimes we just don't know till we start, because don't forget that the person's health is a reflection of all the things they've done in their past, the good things and the bad things. So the idea, if you keep your spine and your body healthier overall, generally you're going to respond faster and quicker.
Yeah, I mean, it sounds you're certainly passionate and you love what you do. You know what I mean? I think it's great to have a job where you come in every day and you're just so happy that you're actually helping people, you're guiding them to better health, you're showing them, what they need, and they may not know that maybe that something was connected here could be totally related to something else, because they think that my pain is here, but it may be directly somewhere else where you can analyze that, for them. So if people wanted to find out more, where would they go?
Well, again, calling the office is great. You can actually we have a website page. We've got testimonials on there. We have Facebook, and so you can check out all that information. And we have a YouTube channel. You can see what people say about our office. So those are all great. And if they still have questions, don't forget they can leave a message and I'll get back to them and I'll call them on the phone. And so we can answer their question on the phone. A lot of people have a lot of great questions. I love answering questions.
Well, thank you so much, Kent. It's so glad to have you here. I'm so excited that you enjoyed this episode of this show, and we'll see you on the next one.